A packed marketplace in Mumbai, just days before India's financial capital hit record high infections. A month-long religious festival that sees hundreds take a dip in the river Ganges daily. People without masks at huge political rallies being held in 5 states holding local elections. Many in India stopped following COVID protocols as cases dropped earlier this year. The price? A second wave that has climbed more swiftly than the first, making India the world's COVID-19 hotspot.
There was a general feeling of comfort across all sections, including the policymakers and particularly the public, that we had seen the end of the epidemic. And there was a feeling that herd immunity had somehow been acquired, and that was going to protect India from any further inroads of the virus. This was absolutely a misconception.
As the country's daily tally crossed 100,000 cases this week, worst affected regions such as Maharashtra state reimposed restrictions. Its capital, Mumbai, shut down shops, restaurants and beaches and imposed a weekend curfew. Delhi has imposed a night curfew. That is worrying the millions who had returned to casual jobs in cities that had resumed normal life after a stringent lockdown.
Last year, we had no work for 6 to 7 months. We were all sitting at home. Only we know how we coped.
To stem the rapid rise of infections, India has boosted its inoculation drive. Health officials this month have begun targeting the younger age group believed to be driving the rising numbers. There is still a long way to go. Although the more than 87 million jabs administered so far are among the largest in the world, they account for less than 7% of the population. To meet its massive need, India has slowed down vaccine deliveries to countries from Indonesia to Africa that are critically dependent on the world's largest vaccine producer. Amid concern that the temporary hold will impact rollouts in many developing countries, India has defended its decision.
We have supplied vaccines to more than 80 countries across the world. We have already stated that our external supplies would be done keeping in mind our domestic requirements. At this time, I'm sure our partners understand that vaccines are primarily purposed for domestic consumption.
India's second wave could determine the course of the pandemic, not just in the vast South Asian nation, but other countries too. Anjana Pasricha for VOA News, New Delhi.